We also looked into the market for a standard product, but we needed a lot of flexibility to cover that production facility with a clinic or a hospital in Spain. We decided that we take it step by step, do it in-house, so that we have the flexibility to build what we exactly need.
Michael, thanks for joining the Sii Talks. Can you please introduce yourself and tell us a little bit about your challenges?
Thank you, Holger, for having me for your Sii Talks. I'm really looking forward to our interview today. So my name is Michael Berberich. I'm working for Fresenius for almost 11 years now. For the last 4 years, I was working especially on managing our group-wide risk management and internal control system.
So you mentioned you are here for 11 years.
Yes.
That is nearly as long or is a little bit longer than we are working with Fresenius, because we started working 10 years ago. So your team is working with us for the last 10 years. How would you describe the overall collaboration with us?
I would just put it in a few words. So the overall collaboration with you is, I would say, always interesting. Yeah, it's an open communication. So we have a transparent dialogue. There's a lot of trust involved now in that collaboration from my point of view. And we are always, I think, looking together for the next spot where we can move our risk management and internal control systems.
How would you best describe your challenges on a strategic level?
I think we could talk hours about challenges, especially when we're talking about the period 10 years ago when we started this episode. Coming from a real decentralized organization, a global decentralized organization using Excel, PowerPoint, Word, for us, it was really difficult to get the right information at the right time from a manufacturing entity in China, in Poland, in Brazil, compared to a German hospital or a hospital in Spain. And as we are always talking about risks and opportunities, I would also try to shed some light on the opportunities. So we also aimed for a tool, a system that could support us to get that information in a unified language from, as I said, a production entity in Brazil and a hospital in Germany at the same time with the same methodology, so that we can use it for informed decisions.
Coming from the past where you worked with Excel on risk management, you decided to develop a tailored solution together with us. Can you describe the process, how it all started and how it developed over the last couple of years?
Yes, that's I would say, a process or a methodology that we use now, I would say, for almost a decade. So we start with a small pilot and we try to do it step by step. And that is also why we use that tailor-made solution. So we also looked into the market for a standard product, but as I described it, we were at the time a really decentralized organization with a global setup. And we needed a lot of flexibility to cover that production facility with a clinic or a hospital in Spain. And therefore, we decided that we take it step by step, do it in-house, so that we have the flexibility to build what we exactly need. And that gave us also the flexibility over the time to stay agile. And if we have ideas on the way in the collaboration with you, so some ideas of that came from your side, from our side, and we just could implement it. And we did not wait for a standard product provider to ask for an update, so we could just do it.
You just explained the history, how the development of FIRM happened, how it all got together. Recently, we started to develop with you ICS for you. Can you describe this for our viewers?
Sure. So the idea is basically the same. So we started with, in some segments, with a standard product. In others, we used Excel. In others, we used different tools. And then we wanted to harmonize all of that. Again, it's the same idea behind it. So we need the right information at the right time at our spot. So we develop a methodology and we need to roll it out so that we have a common language, again, for that organization that we were talking about. And even for ICS, from my point of view, it's even more complicated than talking about risk, because ICS is within each and every process of the business, not just the finance processes, also other processes as data protection, quality, patient safety, looking at our hospitals. And therefore, we need a unified solution that could be used everywhere and could be used easily everywhere. And again, we are in an early phase and we need to stay agile because we get also a lot of feedback from the local level that we directly want to implement in the solution.
So both platforms, FIRM and ICS, are used across the globe, globally, and they are used for all the locations.
Yes, that's true. That's the idea behind that. So we want to have one solution, one single source of truth for each and everyone, for risk and for ICS.
So Michael, how does FIRM and ICS help you at Fresenius to identify, mitigate and report the risks?
That's really the tricky part of it. So we talked about our organization and how diverse it is and how decentralized it is. So we need a solution that works everywhere. So we need to have a solution that is available for each and everyone, and it needs to be as easy as possible to understand it, and it needs to be quick. So we cannot use a solution that takes 1 hour or 2 hours from each and everyone to just report a risk or to report something within the ICS space. So therefore, we just roll out the tool so each and everyone is able to do it and to access it via the cloud, which is the easiest way from our point of view. And then we have an easy, or let's say it, the easiest, from my point of view, methodology that we can roll out to get all the information that we need for those participants. They can type in all the relevant information, then it goes up the reporting chain with different approval levels, and then it comes back to us. We are looking at all that information, and then finally, after some back and forth and checking, we are reporting that to our stakeholders, so the management board and the supervisory board.
It sounds that FIRM and ICS allow you to sit in the driving seat within the risk management area. Is that correct?
That's correctly understood. Yes, we are in the driving seat, so we are starting the reporting phase. That's, I would say, the beginning of it. So we decide when the reporting starts, when the reporting ends, who is participating, and we also decide what we want to know from the colleagues that are participating in a risk reporting run or also even in an ICS reporting run. So yes, that also enables us to be the driver and to be ahead of the process compared to the earlier years, when we were just sending out emails and asking for information where you don't have that direct feeling that you are sitting in the driving seat.
Okay. Let's stay with the picture of sitting in a driving seat, but you as a group function, you also have some customers, so people that want to step on the bus and you need to bring them somewhere from one point to the other. So how does it work with FIRM and ICS when it comes to Helios, Quirónsalud or Kabi?
So we have dedicated risk management and ICS teams also in the segment. So for Helios, for Kabi, also for the corporate legal entities. And we are really, I would say, intensely working together with them. So we have a lot of collaboration. We also get feedback from them, what could be improved in the risk reporting tools. So in FIRM, within ICS for you, you know that. So we get also a lot of feedback from them that we then come back with to you, discuss that and how we can implement that. And for us, that is really a relevant feedback because they are the customers, as I said, so they are on the local level, they are using the tool. And if they have problems using it, we need to solve them, to make it easier for them to use it.
That sounds like you needed a very flexible solution.
Exactly, and that's why, again, coming back to the decision why we use the tailor-made approach, we need that flexibility, because we are learning on the way that we are on that path, and we are taking that feedback back with us and improving the solution, I would say, on a regular basis, and it's not even an annual basis, it's more than an annual basis.
So the risk management is not a one-time moment in the year, but it's a process in Fresenius.
Yes.
So your department is working in the healthcare setting, which is of course a highly regulated environment and also a constant changing environment. So I can imagine that the adaptation process is a constant one. So from this perspective, how does having the IP rights enable you on a strategic level?
Yes, you exactly got the point. As we talked about flexibility and what we need just based on our organizational structure, but it's also the external world, so the changing regulation. So we need to stay agile, we need to adapt, and change things, and therefore, from my point of view, having the IP rights and being, again, using it in the driver's seat to do changes when we want to do them, that is really an advantage from my point of view. Because the opposite would be having a standard product, typically you know that, you wait for an update. Then you ask for additional changes or updates. They take that in the queue. If enough customers have the same idea, yes, that will be change. But we have now the possibility to do that with you. We just arrange a call, we sit together and say, we want to change this and that. Then we take your feedback on that from the technical side, and then we come to a solution. So we are much quicker compared as we would have a standard product.
You have been working also outside of Fresenius. You have also experience and you receive feedback from your peers. What is the opinion about the solution that your team came up with?
So typically, looking at my time outside of Fresenius, there's pros and cons for each and every one. So you can have a standard product, you are very fast with that standard product, you have it standardized each and everywhere. That could work for a lot of companies and make sense. Talking about what Fresenius was at that time and how we evolved, it absolutely made sense, to stay flexible so that we could adapt. Talking about the feedback, yes, we got a lot of feedback talking about our risk management community. So once we discuss with peers, they are also interested how you do this, how you do that. And we say, yes, we have a solution for that. We even have a provider. If you want to make changes, we make changes. On the other hand, this is, as I said, not for each and every company the right way to do it. So you need to have also the resources in-house for that. So the project management skills and an idea what that means compared to just buying a standard product.
Interesting that you mention it, because you initiated organizational change in your unit and you integrated one IT resource into your unit, which is, I think, a pretty uncommon example in the market for risk and integrity team to have an IT resource. Can you elaborate a little bit about that and explain what were the reasons for that?
Yeah, really happy to do that. We were just talking about that internal resources that you need to have to steer such a project. And if you have that resource directly in your team, so that IT resource with that IT background can discuss directly with the methodology guys. And then we have the methodology input, we have the technical input, and they discuss, do we want to go to the right? Do we want to go to the left? What does it mean if you go to the left? What does it mean when you go to the right? And so we get much better output and even a better view on potential use cases and also cost-benefit analysis from my point of view. And just to correct you, now we are not talking about one resource. Now we have already two resources managing that. So that is also a proof point from my point of view that it works. And the feedback also from our organization is that this is really, really helpful.
Mm-hmm. As you mentioned earlier, this own development is not for everyone. So if you now look back the last 10 years and you see how FIRM and ICS is developing within your organization, what are probably the 2 or 3 bullet points or points that you would hint everyone else outside watching as like, okay, if you fulfill these requirements, then you can consider tailor-made solutions in this risk management area?
From my point of view, it should fit to your business model, so it should make sense. And if you have then the challenges that we discussed and described, then it could make sense. But then on the other hand, you should make your decision if you have that skills available, and you need to think about that, what it means. So it's not that you just buy something and it's there within weeks. So that is a long process developing such a tool, and we are developing it now over 10 years. And it's still, as we discussed it's not finished. It's an ongoing process. It will develop and develop and develop. So from my point of view, you need the organizational setup for that, and you need also the skill set for that, and you need a bit of courage to do that, because it takes time, and you at the beginning you don't know what you will get in the end.
Some time ago there was a vendor consolidation process within Fresenius, and we were very happy that you continued working with us. Can you describe for us, but also for the people that are viewing, the reasons for that? What was the strategic background for this decision to continue working with us in this moment?
Yes, thank you for that question. And everyone, I guess, who is looking at that will have an idea about the collaboration that we had over the last decade. And I would just use a few words. So it's, from my point of view, it's transparency, it's an open communication, trust, and always the willingness to find a solution. And that really makes SII, for me, the perfect partner to doing such a development that we had for FIRM and also for the ICS for you.
Thank you for these nice words. I can say that our teams are also like to work with your team and with you. It's always a pleasure meeting you. So how does FIRM and ICS build trust, and how does it influence the work with the internal and external stakeholders?
Of course, it enables trust because now we have all the information available. So we have that single source of truth where we have that picture of a risk landscape and also even the status of our ICS. So is it working? Is it not working? What are the results? So that builds trust. That builds trust internally when we present the results to our stakeholders. It also builds trust externally. So when we are talking about our auditors. So we have our external auditors for the year-end closing. So they are also looking at our tool. They are also looking at our risks and also the results of our ICS. So therefore, that is also a cornerstone for us, having that single source of truth, everything available at one spot, and we can present it directly for internal and external stakeholders.
Mm-hmm. What is on your roadmap for 2026 onwards? What is the vision for your department and for the tools that you're using?
As you can imagine, the vision is to digitize more and more processes. We also want to use the possibilities of artificial intelligence. We already started with pilots together with you in our firm, so in the risk management tool and also within the ICS tool. And we want to see further use cases and evaluate if they are something that we want to have a look at in 2026. But clearly the message is we are going more into digitization and we are going more in AI.
Michael, thank you very much for spending the time with us, explaining the setup of your department and also sharing the vision for the future.
Thank you for having me, Holger, and thank you everyone for watching this and really looking forward to our future collaboration.
Stay tuned for the next episode where we delve again into a topic of risk management with Michael's colleagues.